When it comes to dental products, the conversation is endless. I feel like every day I learn about a new toothpaste, a new floss. I get on social media and they're trying to sell me all sorts of new things that have come out. So when I talk to patients about dental products, I really look at what their personal needs are. And so for somebody who is in relatively good oral health, I usually tell them to keep it simple. So I usually tell them to use a toothpaste that contains hydroxyapatite in it. Hydroxyapatite is actually what our teeth are made of, and it helps to actually heal our enamel from things like acid erosion or bacterial acid secretion. And so oftentimes when I see areas of the teeth that have been demineralized before we run in to do a filling on the tooth, I'll tell the patient, use something like a hydroxyapatite paste to help the area heal, and hopefully we can get this to stop so that I don't have to go in and treat it. Now, for folks who are a little bit higher risk, I might incorporate an additional supplement of calcium and phosphate, and the product I use for that is called MI paste. I really like that to give an additional dose of that calcium and phosphate to help promote that remineralization. When it comes to floss, I just like something that is relatively clean and is made of material that's not harmful to our bodies. I usually like cocoa floss. There are things like Dr. Tongue's carries a floss as well. I usually try to stay away from that really thin white floss, often goes by the name of Glide. Those types of flosses contain things like PTFE, which can be harmful to our bodies. On the conversation with mouthwashes, again, for folks who are in relatively good health, I think you don't need to use anything special. I think a good essential oil-based mouth rinse is great. We use a tooth and gum tonic that's by the Dental Herb Company. I've used it for several years. It's a combination of different essential oils that I really love as kind of an everyday wash. For folks that are at higher risks for periodontal disease, gum disease, gingivitis, those folks I might incorporate different types of mouthwashes that might be more beneficial or targeted at reducing inflammation. I also might incorporate things like ozone into their treatment. Additionally, for everybody, I've been talking more about oral probiotics and the benefits of balancing the microbiome and making sure that we have the good bacteria in there. We use a product called BioGaia that has a really great strain called L. reuteri that has been found to be very beneficial for reducing inflammation in the mouth. So there's a lot of different products that you'll hear about, patients ask me about all the time. And I've done my best to really kind of understand what's in all of these. They all aim to do about the same thing, and everybody will say that theirs is better. I think that products are just one part of keeping your mouth clean. I think there are so many other things that we have to look at, like diet and airway and hygiene, obviously. But it's a never-ending conversation, and I always welcome patients bringing new products for me to critique.